You ever been told that you had adenomyosis and wasn't sure what that meant? Well, if you're been told that you had adenomyosis, most likely it was on like a pathology report. If you want to know a little bit more about adenomyosis, please keep listening. Well, welcome back to my channel. My name is duPont, and I'm a board-certified gynecologic oncologist. And today I'm going to talk about adenomyosis. Now, I'm going over the PALM COEIN system of abnormal bleeding. I've had a few videos where I've educated you on that. It's a classification system that we use to determine why someone's having abnormal bleeding. Well, the P in PALM COEIN is for polyps. And if you haven't watched my polyp video, please check it out. The A in PALM COEIN is for adenomyosis. Now, let's start and talk about what normal bleeding is. When we think of normal bleeding, we mean having a cycle every month. Your cycle will last anywhere from 21 to 35 days. And for you, it feels that it's normal and regular. Typically, when we think about abnormal bleeding, we think about bleeding that's interfering with your quality of life, bleeding more than one time per month, bleeding either very infrequently or too often. Sometimes women who have abnormal bleeding that's heavy may pass clots with their cycles, and that kind of tells me that their bleeding's abnormal. Sometimes women will have bleeding after intercourse or bleeding in between cycles, and all of those are symptoms of abnormal bleeding. And if you have any of those symptoms, please see your healthcare provider. Now, in terms of some of the concerning symptoms that I think about when someone's having abnormal bleeding, is someone that's craving ice or Pica symptoms. And those are when people are usually very anemic. They're craving ice or sometimes clay or even dirt because they're so anemic. And if you're experiencing that, please see your physician or your healthcare provider. Other symptoms are, again, bleeding really heavy, passing clots with your cycles. Sometimes patients will tell me that they're using pads and tampons together because their bleeding is so heavy, and so those are symptoms that are abnormal. And then if you're soaking more than one pad an hour for several hours, that's too heavy, and you definitely need to see your healthcare provider right away. Well, what is adenomyosis? Now, I think of adenomyosis as being endometrial tissue in the muscle of the uterus. It's kind of a cousin of endometriosis. It is part of the PALM COEIN classification system. It's not usually a common cause of abnormal bleeding that I see on a day-to-day basis, but it is listed in the PALM COEIN system, and I wanted to make sure you're aware of it. Normally, we pick up adenomyosis on the pathology report, so at the time of hysterectomy. Sometimes an MRI can show the adenomyosis when the thickness of the wall is compared. Sometimes if you have a really good radiologist that is comfortable reading a lot of GYN pathology, they may have a suggestion of adenomyosis. These women with adenomyosis typically will have really painful, crampy cycles. So I don't always see bleeding, but what I do commonly see is women that had really painful cycles, had to miss school or work because their cycles were just so painful, or had to take medicine like Motrin or any of the nonsteroidals or Tylenol because of the cramps. Those are women that have a suggestion of adenomyosis. But again, we don't know definitively until they have their uterus removed, because usually it's a histologic diagnosis. Typically, some women can have it and have no symptoms at all. So while adenomyosis is listed in the PALM COEIN classification system, it's not really a common cause of abnormal bleeding, but I do see it a lot in women with pelvic pain and just real painful, crampy cycles. So anyway, that's all I have today for adenomyosis. If you have any comments, please put them in the comments below, and I'll see you next time. Thank you for watching to the very end. Bye-bye.